Welcome to Beyond Bones and Muscles, a Legent Health podcast. Created by the team at Legent Health, a healthcare system devoted to helping you live life to the fullest. Your health, our priority. Each episode, Chief Operating Officer Daniel Brazel keeps your finger on the Legent pulse, going beyond the bones and muscles of Legent Health. We will discuss orthopedic and spine industry education and analysis, along with news from around the Legent healthcare system.
Hello, everybody. My name is Daniel Brazel, Chief Operating Officer here at Legent Health, here at the corporate office today, and we're doing our second podcast recording for our Beyond Bones and Muscles podcast. We were able to get through our first one pretty well. Few nerves, but I think it was well received by the team, and our marketing leader Kaylee just really put on a phenomenal platform for us. We've got a backdrop now. We've got some good lighting. So we're going to have some fun with this. And really the goal, as we mentioned, was to put together a platform where we can speak to both an external audience on specific topics relevant to the industry, relevant to our organization and who we are. And then for other podcasts, we're going to have an internal conversation with our teams. Our original podcast that we put together, the first one, was an internal conversation. And then, we got into some of the nuance of the business, some of the key initiatives that we're shooting for, and we're able to have a really good conversation with some of our key leaders from clinical and revenue cycle. But for this conversation today, I'm really excited to talk about something that's near and dear to all of us in the healthcare space, but that's providing excellent care to our patients and the experience of our patients as well. Because clearly we're here to provide care. We don't, sometimes can get distracted with running a business, the distractions of running a business and all the external stakeholders. But at the end of the day, we're here for our patients. That's our audience, and we partner with our physicians to do that very well. So on this podcast today, we're going to go through some of the really phenomenal stories of patient outcomes, patient experiences. This is a week of patient recognition. Today is day one, I believe, February 1st, right, Kayla? So we're excited to have this really launch our patient recognition week by speaking to each of you about some of these wonderful stories. But before I get into that, and I actually invited two of our leaders to give us some of those experiences. Two of our regional vice presidents, Stace Poppy and Kathleen Bedingfield, both regional VPs in two different markets for the organization. Earlier this week, we had the honor of getting all of our corporate leaders together here up in Plano, and we got everyone together for a leadership forum. We try to do this once a quarter, and the goal for this session was to really reset expectations for the coming year, to talk about mission, vision, values. Who are we as an organization? What are our core values? How do we deliver service to our stakeholders? So for the audience, I really want to kind of, reset on what our mission is as an organization. So we collectively discussed the mission and the vision of Legent Health, and where we are as an organization. Our mission is to provide first-class healthcare that puts you first. And it's interesting when you see this quote on paper on our website, you're going to see the word "you" capitalized, right? Because in my mind, when we talk about providing first-class healthcare, clearly that "you," the YOU, applies to our patients first, right? We understand that. We provide first-class healthcare to all of our patients. But that also applies not just to our patients, but we want to provide great healthcare and support to our physicians, our physician partners, and to our staff members as well. So that "you" is sort of dynamic within our organization because it takes on a life of its own in regards to who we're providing great care and support to throughout this organization. So I thought that mission is really fitting for us as an organization. And then as far as our vision is, you think about vision statements and what are they? It's basically, who do you want to be when you grow up, right? We want to be a leader in robust physician partnerships and become a national leader in compassionate quality healthcare that's focused on the patients and available to everyone. We know that healthcare is very expensive. We want to make sure that we have a good value proposition that we can offer to our patients and to the communities. And we really feel strongly that that's where we are and where we're headed as an organization. So that's our mission and vision. Just for those who may not know who we are and what we stand for. If you kind of double click down into the vision and how do you achieve that vision, you have to have some core values as an organization as well, right? You have to have things that you can stand on that identify who you are. And again, this isn't something that the decisions that we make into silos, right? We collectively discuss who we are as an organization and those values. And we feel good about the ones we came away with, which is service, respect, and leadership. And having those three as our core pillars. And within that leadership pillar is also that phrase of accountability, right? Each one of us as leaders, frontline leaders, corporate leaders, regional leaders, taking that personal accountability to provide the best care to our patients and to our community. So anyway, that's sort of a long-winded rehash of our form, but I think the leadership team was energized. We left with a lot of smiles, went out and had dinner, a few cocktails. It was a really good time to kind of reset on the goals and objectives of an organization that, frankly, is still in the early stages, right? We think about Legent Healthcare. It's been around for 5 to 6 years compared to some of the larger health systems that have been around for decades, right? So we're growing, we're evolving, and we're really mastering what we do in regards to being a platform of growth for our physician partners going into the future. So as I mentioned, the U of providing great healthcare to our patients, I think that segues really well into what we're talking about in this podcast, which is Patient Recognition Week, in recognizing some success stories of our leaders and our patients in specific markets. So I'm going to start with Kathy. Kathy's on virtually with us today, so bear with us if we have any technology problems, but I think we got it all sort of sorted out. But Kathy Bedingfield, as I mentioned, is our Regional Vice President of the Houston and Corpus market, and she's a phenomenal leader, educator. She's got a strong clinical background, and frankly, is a jack of all trades, really helping many of our leaders to develop and grow. So Kathy, thank you for joining us today. And anecdotally, you've told me many stories of staff, physicians going out of their way, going above and beyond to provide great care to our patients, and whether it be after hours, weekends, driving many miles to provide equipment to facilities, et cetera. But why don't you tell us some of the stories of some of the patient success stories that you've had in your region? We'd love to hear that, and let's have a conversation about that if you don't mind.
Sure, great. Thank you so much, Daniel, for having me and inviting me to the podcast.
Yes.
It's just really an exciting opportunity to get to brag about what we do at Legent.
Yeah.
And at our centers. I believe that we have some of the best teams around, and I'm so proud of them. And the ultimate recognition for us as nurses is when our patients give us their feedback. And obviously that's how we learn and grow, but it just makes us feel so good when we get some of these success stories, because it makes all of our hard work worth doing. So I'm going to start with Legent North Houston Surgical Hospital, which is in Tomball. While there's many, many stories that are extremely positive out of that hospital, this one in particular really struck me. This is a 53-year-old female who had suffered for many, many years of neuropathy and fibromyalgia, which is very painful. And when she talked to us, she told us that she never ever wanted to play the victim, despite the fact that she had suffered with excruciating pain for years and years and years. She still made it a point to get up an hour early every day before she started her day to stretch and do exercising. She followed all of her physician's advice on what she should do to ease the pain. In the about 6 months before she came to us for surgery, she developed an excruciating pain that was different than the pain that she had had on a regular basis. She said it radiated into all of her limbs. She immediately called her neurologist that she claimed saved her life 10 years prior. And he got her in immediately as he felt like she had a dire need. He scheduled her for a full body MRI. And when the results came back, everyone was a little shocked. Our patient explained to us that, all of her prior problems were in her lower back. And so when the MRI came back to show that she had a herniated disc and bone spurs in her neck from C5 to C7, she was shocked. And she told us, she said, my neck didn't even hurt. So with that, she made an appointment with one of our physician groups that we work very closely with, Advanced Orthopedic Sports Medicine, who she thinks are the best surgeons in all of Texas, and said that she knew many, many people who had seen some of these physicians and that their reputation is just second to none. She met with Dr. Cubbage, one of our spine surgeons, and he explained to her about her herniated disc and her bone spurs and how close they were to her spinal cord. So they, after she spoke with Dr. Cubbage, I apologize, and his assistant Vicky, she had the utmost confidence in them and decided she wanted to move forward with her surgery at Legent. She was a first-time patient with Legent. She had never really even heard of us before. And she said that she had had several other surgeries in the past and that she was amazed and shocked from the time she walked into our building, which is a boutique hospital. So it's a very beautiful, warm feeling when you walk in. She said the receptionist was so welcoming and inviting, made eye contact, welcomed her as soon as she walked in the door. She said then she got up to the surgery nurses that were very, very informative, very, very thorough, took their time speaking to her, explaining things to her, answering her questions, and really just built a level of trust with them. She said they just made sure that everything they were doing she understood and was okay with. Then she met with Dr. Vu, one of our anesthesiologists, that she describes as someone being full of life and just really listened to her concerns. She has a problem with getting nauseous after surgery. And so he pre-medicated her to ensure that when she woke up, she would not experience that. She said, and it absolutely worked. She said no other doctor had ever done that for her before. She said then before she was rolled back to surgery, Dr. Cubbage came in just to verify that she felt good, that she felt positive, that she understood everything that was going to happen to her. And she was just thrilled that he double checked with her. He also explained to her at that time that he was not going to do a fusion. He was going to use new technology that we have that would allow her to continue with a maximum amount of mobility in her neck. She was thrilled to hear that. She was then rolled back to surgery, and she says the next thing she remembers is waking up in a beautiful, immaculate, clean room, which were her words. She said that she never wanted for anything, that the nursing care she had was one-to-one, so one patient to the one nurse, and that she only had to ring her call bell one time, and that when she rang that call bell, they were there within seconds. She said she really loved the fact that she was able to order her food through DoorDash and that we had so many healthy options. She said she's never had this opportunity before. And she said in the hospital, she was used to getting fatty foods that were cold. And by the time you would get them, she said she was able to order from this one particular restaurant that she loves that has the best organic food, and she fully believes was an absolute plus in her healing. And she wishes all hospitals would take some notes on how to handle their staff and patients the way Legent does. She said it was like staying at a 5-star resort.
Wow.
And she said, yeah, she did. And she said that she tells everybody about her experience there. So we are super proud of that. And we really do pride ourselves to make it a concierge experience, to really pay attention to individual patient needs and to listen to them. You know, our motto with all of our centers is to treat all of our patients the way we would want to be treated, or the way we would want our loved ones treated. And I feel like that's what we're doing every day at Legent.
Yeah. Wow, that's beautiful. Beautiful.
Yeah.
You know, it's interesting hearing you sort of talk through the different steps leading up to surgery, post-op, et cetera. Every one of those lanes that she went through was a positive experience.
Yes.
And the reason why that's important, because that speaks volumes of yourself, it speaks volumes of the physicians, it speaks volumes of facility leadership, and for the team in the field who are on the front lines, because that's a culture, right? That's a culture of care, a culture of, you know, wanting to provide and go above and beyond. We've all been through the bureaucratic health systems and know how you can just be a number that gets sort of willed through. but that clearly wasn't her experience. So, I mean, that's just that's phenomenal to hear that story. You have any more, or any additional thoughts on that culture?
I just think that that culture extends throughout all of our centers. Just a couple quick shout outs, I guess. Corpus Christi, our spine care Corpus Christi, we've had a couple of, unfortunately for the patient, they've had to have multiple surgeries.
Hmm.
But we made such an impression that, in their words, they insisted on coming back to Legent because we followed through on everything, and it made them feel comfortable. And so they chose to come to us. One of them said that they felt so anxious prior to getting there and in pre-op, that our nurses were so reassuring, the physician was so reassuring, that they went into surgery with a sense of comfort and relief. And that's exactly what we want, because another thing I tell my staff is, I know that the majority of what we do are elective surgeries, but honestly, when you sit back and think of it, nobody elects for a disc to bulge in their spine or their
Right.
knee to give out. And you know,
Mhm.
elective surgery, I would use it loosely, because they absolutely have to have these surgeries so that they can live a normal lifestyle. And while it might be routine to us in healthcare, it's not routine to them. So we need to make sure that they feel as if they are the most important person. And at the time, they are. And we take care of them that way. And I'm really proud to stand behind that and stand behind my team, and just real proud to be part of this team.
Yeah, I think it's interesting. One thing about you, just to give you a shout out, is most of your leaders at your facilities are first time administrators, first time CNOs, first time DONs, and that is also a daunting thing as well, to help, to step into a role, to establish a culture, to be able to liaise with the physicians. But establishing that platform of culture, of accountability, of caring with your leaders, it's clearly carrying through all the way to the patient, right? Because this is the most vulnerable time in most people's lives, is going into surgery, right? They're helpless, literally helpless. And to have that comfort, that anxiety sway because of the care and the comfort that we provide up front, it speaks volumes to you as a leader, and to the physicians, frankly, as well, for building an environment that is so welcoming for our patients. So kudos to you, kudos to the team, and to those listening in on this podcast. This is what gets us excited. This is what allows us to wake up in the morning and have that energy, is to hear stories like this from our patients, that frankly we get quite often, which is great. So Kathy, thank you very much for your stories and for your energy. Just hearing you speak, it's pretty obvious that the way you speak and that energy translates to your folks. So phenomenal. Thank you.
Well, thank you. Thank you for the opportunity. I really appreciate it.
Stace is another regional vice president within our organization. Stace has a very strong background in medical supplies, equipment, business development, physician recruitment, building partnerships. So he's done a lot. Of recent, in the past year, he shifted into becoming a regional vice president and really owning a market, owning the operations. So I'd like to go to you, Stace, now, and have you tell some of your stories within the San Antonio and Austin markets as well.
Thank you, Daniel. Thanks for the introduction. Tremendous story for Kathy. As with all our facilities, we really obviously focus on tremendous patient care, but we really put a lot of focus on the patient experience and what that means, because these people are trusting us, and it is, like you said, elective surgery, but they are having a whole lot of pain, and they're not able to live their lives like they're used to or want to. So I have another kind of story to tell with our Legent Orthopedic and Spine Hospital in San Antonio. We do a tremendous amount of volume, and I'm going to talk today about a total joint patient, and we do over 50 total joints a week at this facility. So we do quite a few, and so there's stories that come out every week about our staff and our surgeons and the care we take, and how the patient experience is different at every than they've ever experienced or heard from some of their friends that may have had the same procedure at another facility. So this particular patient came in, and it was their first total knee, their first joint replacement. They had never had one before, and like most patients, they were nervous about surgery. They said from the minute that they walked in the door, the staff at Legent Hospital made me feel comfortable and confident, and they were wonderful. The moment I arrived was the moment I left, and they kind of hit some high points that said the admitted staff was extremely friendly. They checked me in quickly, explained everything I needed to know. They walked me up to my next location and made me feel comfortable. Said the pre-op staff were caring and professional. They prepared me for surgery. They answered all my questions. Another little thing is, so they talked about how it was a warm environment. A lot of times surgical hospitals can feel, or hospitals can feel kind of cold, and they made sure I had enough warm blankets and checked on me often. And so then once I've actually wheeled back, the surgical team, they said, was amazing from the surgery. Seemed like it went by very quickly. They said I checked on me after surgery multiple times to make sure in post-op that I was comfortable and didn't have any pain. And then, post-surgery, they said physical therapy was exceptional. They provided me extremely good care, very attentive, very compassionate, very helpful, and said, help me with my pain management mobility. She said, with little pain that I actually did have, they kind of stated that their pain level was very low, which, that's kind of, with the physicians that we work with and their type of care. But, it is a very scary thing that people think they're going to have a whole lot of pain. So that's great to hear. And they stayed one night at the hospital, and they felt like they were in good hands the whole time. And so they were, they got to pick out their food, and it was like felt like they were at a restaurant when somebody came in and actually took their order, and they weren't just brought in food as far as what they wanted to eat, what time they wanted to eat, how they felt, any allergies. Really, took that patient experience to the next level. And then they kind of followed up their last statement saying they highly recommend Legent Hospital, all their friends, for any kind of joint replacement surgery. So that was one story. And we, like I said, we hear these stories like this in reviews, kind of weekly. So
that's fantastic. Yeah. I love it. I love it. You run a very complex market. The facility that you were referencing, to your point, 50 joints a week. We do tons of spine procedures. So a lot of high acuity going on through those doors. But, your staff, your front line, to your providers, to your support staff, everyone is in lockstep. It's just a nice machine to see. I've been there personally many times, obviously, and just to see that it's like poetry in motion, right? It just flows so smoothly, and the patients can see that. They can see that cohesion, and it translates to when you get excellent reports like this. So thank you, Stace, for really bringing that up. And mind you, we've got tons of these stories, right? One of our other leaders, Brittany, another regional VP, Brittany wasn't able to join us, unfortunately, because she was tied up with some operational matters that things come up as RVPs, as we know. But she's got some very similar stories. But I also have a story that I'm going to kind of wrap up the podcast with, because I wasn't unfortunately, I ended up being a patient of one of our hospitals as well. Wasn't planned. Again, I wouldn't call this one elective because it was slightly emergent. And I had to visit the Legent Orthopedic Hospital in Carrollton. And, very anxious. I'm out here in Texas by myself. My family's back in California, and had to have emergency surgery. So, I go into the facility. Physician speaks to me, Dr. Evanson, phenomenal orthopedic surgeon. The team, Brittany, Cole, CEO of the hospital, Tammy. I can just go on and on with the leaders that came and cared for me. But, maybe it was if originally I thought, well, maybe it's because I'm, an executive at the company, they're rolling out the red carpet, and maybe this isn't the norm. But when you start to hear these patient experience stories about how we care for everyone the same, with the same high level of care, what I experienced is just like what I just heard today from our two RVP leaders in regards to the experience of Legent, the caring nature of Legent. I was able to order the food that I wanted. I got Chick-fil-A that night, which was fantastic. I've been at other hospitals, and the food's not that good. I love Chick-fil-A. I had tons of snacks brought in, whatever drinks I want. I mean, it was just a great experience. I slept good. They kept checking on me. I said, don't need to come back anymore. Let me get some sleep. But it was just a great experience. And I just, my patient satisfaction report that I sent back to the facility was just, it was raving about the care that I got. So it hit home. It hits home to hear the stories from Stace and Kathy, because that was me as well. And that's many of our, many people that come through our facilities have these phenomenal experiences. So again, Patient Recognition Week, these are the stories that we wanted to tell. I'm going to wrap it up just with, thank you to the audience for tuning in to our second podcast. They're going to get better. They're going to get more informative. We've got some really amazing leaders that are going to be coming in and speaking to us. We've got some internal conversations that we're going to have, some frank conversations as well. But just continue to tune in to our podcast. It's going to, continue to be evolving and more robust. But this is fun. This gives us a chance to talk, for you guys to get to know myself and some of our other leaders, us as an organization, and for the external audience, we are Legent, right? We're here. We have a staple in Texas and Florida. We're growing, and this is the experience that we provide to our patients. So we hope you guys enjoyed our podcast, and tune in next time when we discuss more awesome topics on our Beyond Bones and Muscles podcast. So with that, thank you, Stace and Kathy, and hope everyone has an amazing rest of your day.
Thank you.
Thank you.
Thank you for listening to Beyond Bones and Muscles, a Legent Health podcast. We want to hear from you. Subscribe and leave us a rating. Your feedback helps improve our show. For more information about Legent Health, go to legenthealthservices.com.